Hey everybody, Dr. Darren Smith here with a couple words on performing a tummy tuck or abdominoplasty at the same time as paradoxical adipose hyperplasia correction. So backing up a minute, what is paradoxical adipose hyperplasia? It is that really unfortunate side effect of cool sculpting where fat grows instead of shrinks. And this is something that's really tough to treat and something that we do a lot of, and we do it really well. We've been getting great results by combining vasoliposuction and body tight radiofrequency skin tightening. And this is something you can learn more about in some of our other videos. This video focuses on a trend where now a lot of people are looking into getting tummy tucks or abdominoplasties at the same time as they're having their PAH or paradoxical adipose hyperplasia treated. So why is this appealing in the first place? Well, sometimes paradoxical adipose hyperplasia can be so severe, or the anatomy can be such, that after treating the excess fatty tissue, after that's removed with vasoliposuction, and even after treating the skin with radiofrequency skin tightening, there can be some loose skin left behind. And this can be a problem, and in a lot of cases, or in some cases, this is something that's best dealt with an abdominoplasty or tummy tuck. And this is something that should really be done as a secondary operation, that is, in a separate operative setting. It should not be done at the same time as the paradoxical adipose hyperplasia treatment. And the reason for this is the same as the reason that you wouldn't want to perform significant volumes of liposuction at the same time as a tummy tuck. And that is when we perform an abdominoplasty, we are actually challenging the blood supply of the skin of the abdominal wall. So if you look at the anatomy of the abdominal wall, you are going to see that the blood supply is coming from four primary places. There are two large blood vessels coming in from the top, under where the breasts are, and two large blood vessels coming from below, where the pelvis is. When we perform an abdominoplasty, we are essentially lifting up the skin of the abdominal wall using a long horizontal incision that goes along the waistline. That incision actually cuts off the blood supply from below. This leaves only the upper blood supply intact to supply that abdominal wall with the blood it needs to heal properly. So if we perform extensive liposuction of the abdominal wall at the same time as we're performing an abdominoplasty, we put the abdominal wall at risk for things like tissue healing problems or tissue necrosis, where the skin can actually die and you can end up with a very severe large wound. So just like in cases where there's a lot of excess abdominal fat in the subcutaneous plane, we're going to recommend staging that operation. We're going to do some abdominal liposuction, get rid of that extra fat, let things calm down for about 6 months so that the abdominal wall can regain its blood supply, and then we'll come back and do the tummy tuck and get rid of the extra skin. We're not going to do a lot of abdominal liposuction at the same time as an abdominoplasty or tummy tuck. So now let's go back to the case of paradoxical adipose hyperplasia. When we treat paradoxical adipose hyperplasia, the fat involved is even tougher and more fibrous and more difficult to get rid of than the fat that's present in the case of a standard abdominoplasty. So now, instead of just suctioning out the fat as we would in a standard abdominoplasty, when we're treating PAH or paradoxical adipose hyperplasia, we're going to be using energy from Vaser, which is ultrasound energy, and often energy from body tight, which is radiofrequency energy, and really subjecting the abdominal wall to a significant amount of trauma. So to then, perform that procedure to subject the abdominal wall to significant trauma and then cut off its lower blood supply with a tummy tuck, you're really taking a significant risk that you're going to get wound healing problems or tissue necrosis. So while it might be tempting to kind of get things done quickly and done all at once and have your abdominoplasty performed at the same time as your PAH correction, it is really the safer approach to have your PAH correction, let things settle down for 6 months to even a year, and then come back and have the excess skin removed with a tummy tuck. The other advantage to this approach is that you might find in a lot of cases that you might not even need the tummy tuck. So you might have your PAH removed, you might use the Vaser energy to get rid of that fibrous fat, that tough fat, you might use your radiofrequency energy with your body tight, and you might find that over time the skin contracts enough that you no longer need the tummy tuck, and that can result in significant cost savings, and you can also avoid that low horizontal abdominal scar that you would have with the tummy tuck. So lots of reasons to wait and do this procedure in 2 stages. So again, we highly recommend to our patients having their PAH corrected first with vasor liposuction and bipolar radiofrequency energy or body tight, and then waiting 6 months to a year, and then if appropriate, coming back and doing an abdominoplasty.